Okay, part 2 questions to ask your surgeon for tummy tuck in the initial consultation meetings. So, like where I left off in my last video, we were talking about where do they operate. So some surgeons operate out of a hospital. Some surgeons operate out of their own building facilities. For me, I wanted to be with a surgeon who operated in a hospital, preferably one in a bigger city that had a higher level of intensive care should something go wrong. I have kids at home, so I'm not willing to risk being somewhere where I can't be taken care of should, in the event that something bad happen during surgery. Not saying that is going to happen, but it was just a worry of mine personally and just a anxiety that I had. So when I was searching for my surgeon, I wanted to make sure that they were operating out of a hospital. Not all of them do. If they do not operate out of a hospital, what do they have in place should something happen? Should a blood clot go? Should you have a reaction to anesthetics? Should you have excessive blood loss during surgery? If you're not in a hospital with a high-level trauma center and an ICU that they can get to you immediately, what are their policies in place, and what hospital will you be brought to? Are you going to be brought to a hospital that is covered by your insurance? So, like all those different things, make sure you really think about that one. That's going to cater to you, your individual needs, stuff like that. With the hospital question comes the risks and risk assessment that they have for you personally as a patient. What risks do come with tummy tucks? If you have issues in the past with blood clots or are on birth control, what is there any increased risk? Is there increased risk because of smoking? Is there increased risk because of X, Y, and Z? Make sure that you sit down and actually talk to them about risks individualized for you, your situation, your health history. Another one for me was anesthetics used. So I wanted to be out cold. I did not want to be awake for this. Some surgeons use, like I'm going to a hospital where there is an anesthesiologist that'll put me under. Some surgeons use an epidural. Now I'm having my body chopped open and my muscles stitched together. I had all my kids naturally, so the idea of having an epidural and having a whole tummy tuck done, I didn't want any part of it. I wanted to be out. I want to be unconscious. Now for some people, they have the reverse anxiety. They do not want to be out, so the epidural route is better for them. Some use a local anesthetic. Some put you right under. Just talk to them about what they use and what their anesthesiologist prefers to use and why. Another one is pain management. There are options for pain management. Talk to them about what they prefer, what they recommend for you. If you cannot take pain pills, what do they have in place? Some surgeons offer this drug called Exparel, I believe is what it's called. It's an injection. It's a pain blocker. I believe it works with the nervous system to block the pain without the effects of opioids and other sorts of drugs like that lasts up to 3 to 4, sometimes 5 days while you're in that major initial trauma phase of healing. So that might be out of pocket. That might be an additional expense. Sometimes it's like $600 to an additional $1,000. If that's something you're interested in, talk to them about that. And then just talk to them about the general pain management that they offer and if it meshes well with you. Another one to talk about is a revision policy. If you are not happy, what is the revision policy? Do they go back and fix mistakes? They're human. Things go wrong. Bodies react and respond differently. Bodies look different on a table than they do when they're healing, when you're standing up versus laying down. Not everything is their fault, and just it's a part of the process when it comes to surgery. So remember, they're human too, and talk to them about the revision policy that they have. Another one to talk about is body shape. So be realistic too. If you have a wide rib cage and you do not want a box shape, because they're typically with tummy tucks, you get a really great result, or you get the Barbie doll effect, or you get the box effect. I was terrified of having the box, so I wanted that snatched in hourglass waist. It worked well for me because of my natural body shape, and he was very upfront and honest with me. And showed me his results pre and post op with other patients, and the results that they got because of how their bone structure, their rib cage was set, the way their hips were set. So talk to them about the body shape that you're looking for, and remember to be realistic, because what you see on Instagram and these other social media accounts are not necessarily real, and they're probably edited. So keep those expectations, somewhat reasonable. But it is okay to ask, I don't want this particular look. Are you able to help me achieve that? It's perfectly okay. Another one to talk about is belly buttons. Some surgeons have really terrible looking belly buttons. Some surgeons don't even put a belly button back until like 6 weeks post or 6 months post-op. I don't want to be walking around without a belly button. To me, that's weird. I understand why some surgeons do it. Some people are okay with that. For me, definitely didn't want that. I wanted a really good looking belly button, so that's why I met with 7 surgeons until I found the one that I wanted. Talk to them about the belly buttons. Lymphatic massages. Oh, and also about belly button cleaning and like how they deal with that shape, belly button shapers. Like there's this whole world about belly buttons with tummy tucks. Definitely talk to them about the belly button issues. Okay. Lymphatic massages. Some surgeons recommend it, some don't. Ask them why. Ask them why not. If they have people that are included in their packages, if they have affiliates. Lymphatic massages sometimes happen, sometimes not. It is what it is. Talk to your surgeon about that. Prices, what's included, meds, pain medications, the anesthetics, the fajas, the garments, the lipo boards, what all is included, what do you need to buy extra. Some surgeons have everything. They even include the scar cream. Some have everything itemized out. So talk to them about what's all included in the price. Pre-op, do they do blood work? Do they check iron levels? And if you do not meet pre-op standards, what's their cancellation policy? Or if other emergencies come up, things happen, life happens, we can't always be in control of that. So what is their cancellation policy? How much do they get back? If at the pre-op appointment, your BMI doesn't meet the requirements and your iron levels are too low, for women who are menstruating, that's a real possibility. Are your iron levels too low? Some surgeons cancel, like I've talked about in my past videos. So talk to them about the pre-op and what happens if you don't meet certain requirements. Do they reschedule? What's the deal there? So definitely talk to them about that. And the last 2 things, drains versus drainless. What do they do? Also, if you have wound care issues, infections, necrosis, popped stitches, seromas, what do they do for that in their practice? And why do they do drains? Why do they do drainless? Those are questions to ask that are very important. How long do they leave the drains in? Do you pull them out yourself? Do you have to go to an ER? Are you in the same country as your surgeon? And are you going to be leaving? What do they recommend? If you're getting a tummy tuck in Tijuana, Mexico, and you fly home 3 days later, or in Miami and fly back to Washington State, what's their policy? What do they recommend for those who are leaving right away? Because people do cosmetic procedures all over and then go home. That's a thing. So ask them what their policies are for stuff like that. And then finally, the last thing is multiple procedures. If you're getting breast augmentation and a thigh lift and chin lipo and arm lift and all these different things along with your tummy tuck, what's safe amount of time to be under? How long are these procedures? Can they all be done in one? Do they recommend breaking them up? And why? Is there discounts for breaking them up? So if you're planning on doing multiple procedures, that is something you want to talk to them about in that consultation, not the pre-op appointment. Find out their policies and stuff like that. So those are my main questions that I asked for my tummy tuck surgeons, like specifically. If you want me to go into ones about the whole breast augmentation stuff, I can also do that too. I got a whole other separate list of questions for stuff like that. Just let me know in the comments below and we can get to it. But anyways, I hope this is really helpful. There really isn't a whole lot of guidance on what to ask a surgeon. So these were all the things that I found over the many, many interviews and all the money that I spent for consultations with different surgeons. So I hope it helps some of you guys out. If there's anything in specific you want me to cover, just let me know and I will see you all later. Bye.